So what would I do to support my child to increase their food range?
That's a really big and great question. It's tricky because children with ARFID don't often acknowledge there's a problem. They're quite happy to eat their limited range. They don't want to eat their non-preferred foods. And in fact, there's a massive disgust reaction to these non-preferred foods. They, see them as, in our feeding clinic, we talk about eyeball stew, that new foods for a child might as well be eyeball stew because it's so disgusting to them. And so these things are quite hard to shift. And children can be prepared to starve rather than eat non-preferred food. So we have to treat carefully. And we can think about strategies that don't work, like what are the things we shouldn't do as well as some of the things we should do. So the things that don't work are things like force feeding, which parents are often wanting to do out of desperation to get that food in. Or have really lengthy meal times that can drag over an hour to an hour and a half, which for a child that becomes like a punishment, and then you have that negative association with food.
That would be tricky.
And parents can often try to make their child feel guilty about not eating. That doesn't work. Or they might compare to siblings, or trying to make them feel bad about not eating, or that they're not eating the food that when other children are starving, or that the parents struggling to pay for food and yet the child's not eating it. And there's lots of issues.
Yes, it's tricky. It's tricky for the parent as well, because it's just that need to nourish and to it's and then it's sometimes it's not knowing how to get the child to feed. It's difficult, isn't it?
Absolutely. And it's hard for the parents because they often are given all this advice by people that with good intentions about how to manage it, but it's not helpful advice, and parents can feel judged, and it's tricky. So there's a whole lot of things that are not helpful, and then there are things that are helpful. So things that are helpful are just to be providing food in a playful way. When we think about managing anxiety, we think about exposure work where we have to have repeated exposure. It's the same journey with food. You need repeated exposure in a fun, playful way to non-preferred foods to make them more familiar and less scary. And given that food is a sensory experience, we play with the senses. We talk about what it looks like and what it smells like, and if we bite it with the teeth, does it have a crunch, or is it a soft food? And so you sort of play with the food in a fun, playful way to make it.
And not a stereotypical.
Eat it. It's not just sit down.
So you're sort of like experimenting with the way they're actually eating. And
you do that obviously according to the developmental age of the child. So with young children it will be more around the play, and for older children it would be more around having a preferred food and a less preferred food, and you might compare them. What is similar about them, what is different, what can they taste if they lick it, do they bite it, is there a difference in texture that they can notice, which one chews more easily. So you can sort of work according to developmental age of the child with the food exploration.
That's good.